series. So video 1 to 3, we were looking at motion in the pelvis and lower back. And we've now moved on to video 4 and 5, where we're actually doing a little bit with these therapy balls. So I'm going to pop the therapy balls back into the little net for this one, and we're going to tighten the toggle nice and tight so they can't escape. You're going to pop down, we're going to lie back down onto our mat or onto our floor. And we're going to go back and just recap over a movement that we did in video number 3, where I had one leg long, one knee bent, and we were looking at this kind of transverse motion of the pelvis. We were probably getting a little bit of a sagittal plane motion in there as well, and you might have even been getting a little bit of frontal plane. So we're looking at kind of this three-dimensional motion of the pelvis. As I breathe in, I ground through the foot, I reach the knee, as if somebody's kind of lightly tractioning the thigh bone out of the hip socket, and the pelvis begins to rotate, in this case towards you guys, towards the camera. And we're just doing what feels super easy for us to do. So we're going to take our therapy balls now and pop them into this movement. So I'm going to be popping the therapy balls here on my long leg side, the right leg. And I'm just going to come up for a moment so that you can see where the balls are going to go. So center of the spine, just kind of above the waistband of my pants. I'm going to put both balls here, string on the outside, on the lower back right hand side. So the easiest way for me to get them in is to actually just let my pelvis rotate a little bit to the left. I'm going to pop those therapy balls in, and then I'm going to come back and rest on top of them. Relax and lengthen the right leg out. And we come back to our little movement. Breathe in, press, reach and roll. So I'm allowing my weight to roll into the therapy balls, and then I'm backing off. So you might feel a little bit kind of crooked or uneven when you pop the balls in on one side. Don't worry too much about that. So we breathe in, press, reach, roll, and then breathe out as we relax back. Now, if it's the case that you find somewhere along this journey that feels a little bit tender, I like to kind of hang out here, and sometimes I haven't got a cushion right now, but I'll pop a cushion or some kind of support here underneath the left buttock, so that I'm not kind of holding it up there, and then just allowing myself to take a few breaths, and just again trying to relax into the sensation that these therapy balls are creating. So using your breath. So I like to breathe in as I rotate towards the camera, and breathe out as I melt back. But sometimes I'll change that and I'll breathe out as I roll into the therapy balls, and breathe in as I come back. So you can decide what feels best for you, or play around with it. To move the therapy balls, I'm going to rebend my right knee. I'm going to reach the knees away. I'll come up a little bit higher so you can see underneath. All I'm doing is I'm rolling those therapy balls up just a little bit, and I'm coming back down on them. So position number 2, if I was to kind of draw a line from my belly button around to the back, I'm going to meet those therapy balls. I re-straighten or I reset into my starting position here. I've lengthened my right leg out, and I can begin that whole journey again. So I'm using the in-breath, I breathe in, I press the foot, reach the knee, allow the pelvis to roll, and breathe out and melt back. For some people, not all people, as we go higher, we feel a little bit more. So I'm one of those some people. For others, they're feeling more lower down. So depending what's going on with you today, you might notice different sensations as we move into different areas here of the lower back on the right hand side. So once you've done a little bit there, we'll move to stop number 3. So again, we rebend, reach the knees, lighten the weight, move the therapy balls up about 1 inch, so kind of right in underneath the lower ribs. And then once again, same technique. Breathe in or out, depending which way you're using the breath this morning. Press the foot, reach the knee, and allow the pelvis to rotate. Once you've spent enough time, so you'll be spending a little bit longer than what I've spent, you can take the therapy balls out, and we will go and do the same thing on the opposite side. So we'll straighten out the leg that the therapy balls are on, so the left hand side. I'll bend the right knee, and then breathe in, press, reach, roll. Breathe out and return, or if you're breathing the opposite way, breathe out, press, reach, roll, and breathe in as you come back. Quite often what I see with my clients when they've got lower back stuff going on is that this will be very different between the two sides. So they might have one side that they do this and they're not feeling anything, and then on the other side they're feeling quite a lot. So guys, hope you enjoyed that, hope it was helpful. Thanks for watching.